Hi there, my name is Dr. Andrew Linklater, and I am one of the emergency and critical care specialists at Lakeshore Veterinary Specialists. Myself, along with three other criticalists, are the team who are sort of supervising, mentoring the internship and residency program at Lakeshore. I want to take a few minutes to just sort of give you a little bit of information about the unique aspects of Lakeshore and talk about why you might want to come spend some time with us. So I think some of the, and I'll also try and answer some of the common questions that come to us just regarding the schedule and that sort of thing. So I want to start out with talking a little bit just about Lakeshore and sort of the culture that we've advocated for here. Certainly the specialists here are all a group of individuals that are very communicative, very collaborative. That is the environment that we all want to work in, and it's something that we've worked very hard to encourage and nurture at Lakeshore. So it's very easy to approach the surgeon or the dermatologist when you have those questions about those cases, or maybe have someone look at an x-ray or something like that. No one's walking around with like a big head on their shoulder saying it's my way or the wrong way. We usually take a general approach of let's work together to solve this problem together, and communicate about which might be the best way to go for an individual pet. We also do try and rely as much as we can on the scientific data that's out there to help us support those decisions, and often use those discussions in our grand round sessions to help make those decisions. So I think we're a group that communicates very well. We all kind of get along with one another, which is what everyone's looking for. Not that we don't necessarily have some individual disagreements that may occur, but when that happens, we're going to have a system by which we approach that to decide how best to move forward, so we can continue to collaborate and work together. The four of us, the four critical care specialists, have been charged with being the mentors of the program, really, and we're the ones who sort of have dedicated time to mentor the internship and residency programs at Lakeshore. And because of that, we dedicate a lot of time to making sure that our we call them the house staff, but our interns, our residents, are growing in their professional careers, and to make sure that we have dedicated time to do that. So, ways in which we do some of the dedicated educational things that we have at Lakeshore. Number one, of course, we have dedicated rounds time. So every week, currently it's on Wednesdays between 2 and 4 p.m., we have dedicated grand rounds time. And usually we try our best to have our associate doctors cover that time, so the interns and residents can really focus during that time. And our grand rounds are going to be quite various throughout the course of the year. At the beginning of the year, we do have an intense 2-week program that is basically half classroom learning, mostly done by the criticalists. Some of it's a little bit of HR stuff and where you get your uniforms and that sort of thing as well. And then through the course of the year, let me finish that first 2 weeks, that orientation program. You're spending about half your time in a classroom setting. We're kind of getting everyone up to speed, where we want them to be, where things are gonna hopefully progress through the year, and try and get everybody on the same page. Go through some of the common emergencies that we'll see and sort of our expectations for the year. The second half, or the second portion of that 2-week, is really on the floor learning. So you get to know our computer system, our policies, procedures, all those types of things, how we take deposits, how we enter in our medical records. You spend some one-on-one time with the doctors who are familiar with those programs and get an idea of how those things work. So we're not just gonna throw you to the wolves, as they say. We're gonna be there to help support you through that, and you'll have an opportunity to sort of practice some of your medical records, practice generating an estimate, and having some of those communications with owners. I was going into a little bit about some of the education that we do at Lakeshore. So as I said, we have 4 of us who are dedicated to the program, and we do a lot of the education. So during our grand rounds time, that's that Wednesday from 2 to 4 p.m., we have a dedicated 2 hours where we are going to do a variety of things. There are, of course, a bunch of presentations put on by us as the criticalists. We do get the other specialty services, cardiology, internal medicine, and so forth, involved in those lectures as well. So you certainly do get some exposure to those specialties as well. Other things that happen during the Grand Rounds time, we do have Journal Club, which is usually a group of us focusing on one topic. We sort of present that information and discuss it openly. It's often based off maybe a case that we saw or something like that, where we want to improve our own medical care. We do, of course, have M&Ms. We've had some compliments recently about the way that we run our M&Ms program. It really is a group learning session. We're all trying to learn how we can make things go a little bit better for everyone. You just saw a leaf fall on me. As you can see, I'm actually giving this little presentation here from my backyard on a beautiful November day in Wisconsin. I think we're gonna hit like 73 degrees here today in early November, so that's quite nice. Moving on with some of the education, you know, the interns and residents also do give a presentation during the course of the year, so that's in there as well. The interns generally are going to give it in the latter half of the year. The interns and residents will give theirs, the residents will give theirs throughout the course of the year. And we do have some hands-on labs as well. We've done endoscopy labs, airway procedure labs with cadavers, usually with donations from owners, that type of thing. And various other procedure labs that ultrasound labs, that sort of thing, where you can certainly improve your skill for the things that you're going to see on a regular basis with us. I think one of the things that Lakeshore does exceptionally well is provide a level of support in a variety of ways. So how do we provide that? Well, number one, each intern and resident has their own assigned mentor, someone that you can go to and discuss, you know, how are things going. We have regular check-in meetings. Probably the biggest and most important way for support is we're there. We're on the floor with you. We're helping you through these cases. We're discussing the diagnostic monitoring and treatment plans, or differential diagnoses, and all sort of that thing on a one-on-one basis, basically with every case that you're seeing on the ECC service. So currently the schedule for the criticalists is generally from 6 a.m. until 11 p.m. basically every single day. Now there's 4 of us and we do take time off from time to time, so there are sometimes gaps in the schedule where there might be only one criticalist during particular days of the week or on the weekend, but we are there 7 days a week to provide that support. We're also basically on call 24/7. We make sure we make sure that we are available to you to answer any questions, even for those few hours when we're not actually in the building. To address that a little bit, there will be some times when an intern or resident might be on their own. For the interns, we try and schedule it as much as we can in the latter half of the year, so you've seen some of these cases before, you know sort of what to expect. We're not going to leave you in the lurch. We're not going to leave you without support in any way. We're here to answer those questions. Like I said, we're there a lot of the time during the day. It's generally 7 days a week, and when we're at full schedules, we're there from 6 a.m. Until 11 p.m. pretty much every single day. The other ways that we do provide support, as I mentioned, is an on-call system. So currently at Lakeshore we have quite a wide variety of on-call. The 2 biggest on-calls is going to be one that is split between the criticalists and the internists. So that's basically 24 hours a day. Of course, we're there during the day, but mostly in the evening and overnight hours. Maybe on weekends and holidays, that sort of thing. There is going to be a specialist that's available to you on call, basically 24/7. There is an assigned person, so hopefully we can get some shut-eye once in a while. We'll give you some guidelines as to who to call. If I'm leaving at 11 o'clock at night and you have a question at 1 in the morning, you're probably going to call me rather than wake somebody else up who maybe isn't familiar with that particular case, for example. We do also have the medicine on-call is basically split between the internal medicine specialists and the emergency and critical care specialists. Currently, right now, myself and Dr. Rudloff take the entire weekend from Friday through Monday morning with the on-call, so we are available like 100% of the time to you. The other way that we provide support just on a general scheduling basis is to try and never leave you without the support that you need in the building. So of course we're going to have our technical support as much as we can there. For newer doctors or new graduates, there's going to be someone generally in the building with you almost all the time, and you can say, hey, can you have a look at these x-rays or help me interpret this blood gas? There is also emergency doctors at our other 2 facilities, the Port Washington and the Oak Creek facility, who can help answer those questions. Maybe it's not a life-threatening thing, but you want someone to sort of double check what you're doing before the morning crew comes on or something like that. And as I said, we try and make the schedule so you're basically never alone. At the same time, we do want everyone to get that experience where you're the doctor, you have to make these decisions. And so particularly for new graduates, mostly interns, in the later half of the year, there are going to be those times when you're alone, but there's always going to be that support there available for you. Other ways that we are exceptional at providing support, I think, is our veterinary social work program. So at Lakeshore, we have, not only do we have 2 full-time veterinary social workers who are on staff with us, which I think is a unique aspect to Lakeshore and not something that all clinics are actually able to even afford to do, or all internship programs are able to afford to do that. But certainly they're here to help not only our clients, which is a big relief of burden to the emergency and critical care staff. So they'll consult with clients who are having to make difficult, maybe end-of-life decisions and having to make some really tough and sometimes expensive choices regarding their family member. And that allows us to, it takes a little bit of that burden off of the emergency crew to sort of be able to focus on the patient care and the doctor and technician aspect of it. Granted, most emergency doctors feel pretty comfortable and proud of the way they handle things like euthanasias or end-of-life decisions. That doesn't mean you can't do that, but when times are busy and you have several patients to care for, that veterinary social work team is really there to help the clients in that situation. The nice thing about it is they're also there to help us. The vast majority of our staff have had a consultation with our veterinary social work team, myself included. You know, life gets hard sometimes, and we all need to discuss things about how to move forward in some trying situations sometimes. And on ECC, we have to deal with a lot of grieving clients and sometimes upset clients as well, and they can help us sort of navigate those subtleties of some of that those difficult conversations or emotional times for us as well. That is a big way that we support our staff in a lot of ways. So we have 2 full-time social workers on staff, and they actually also have an internship program, which really broadens and expands the availability of the social work team to be available for us into the evenings a lot of the times, into the weekend hours as well. So we have that support there as well. We do get a lot of questions about the schedule, and I'll try and answer some of them right now. Let's start with the ECC program. Both the internship and residency is very similar in terms of its scheduling. There isn't really much of a difference between the interns and residents to start off with, but as the year progresses, that might change. As I said, we want to get you that one-on-one time with the specialists who are on staff to help you through those cases. But later in the year, we also want you to sort of spread your wings and fly a little bit. The nice thing about the schedule as we have it set up is the interns and residents are the primary caregivers. It's not like the 4th year rotations where you're following somebody around and just sort of learning from the cases that you see, but you're the active participant. You're the one who's making the phone calls to the clients, you're the one who's making the medical decisions, writing the treatment orders, all those sorts of things that can come up when you're dealing with critically ill patients. And that is really where a lot of the learning comes from, is that one-on-one case management. You're talking with a specialist to guide you through sort of managing some of these cases. So getting back to the schedule a little bit, mostly there's sort of 2 groups of schedule. There's the ICU schedule, which generally is a 6 a.m. to 6 p.m., so it's a 12-hour day, 4 days per week. That's how that's set up. So there's an AM shift 6 a.m. to 6 p.m. and an overnight shift 6 p.m. to 6 a.m. And we try as much to have you sort of consistently on that rotation for a number of weeks, and then you'll get switched to maybe one of the receiving rotations. Usually by the time you get through rounds, you get your paperwork finished up, that sort of thing, these shifts might end up being 13, 14, sometimes 15 hours, depending a little bit how efficient you are with your medical records. And we're here to help you sort of gain that efficiency as well. So that's sort of the receiving, the ICU shift. So it's 4 days a week, 12-hour days. And for the receiving shifts, we have a variety of shifts. Generally, it's going to be a noon to midnight, 2 to 2. Sometimes there's a 10 to 10 or an 8 to 8. So it's generally a 12-hour receiving shift, again, about 4 days a week. So we do have you scheduled for that period of time. the nice thing about it, having a 4-day schedule, which is probably different than, certainly than a lot of the universities out there, might be different than some other private practices as well, is there is that period of time, and it's 3 days that you have off. Now, we use the term off loosely. It's sort of our expectations that you will use one of those days as sort of an off clinical day to read up on your cases, to prepare for journal club, get your project or presentation ready, that sort of thing. And then, of course, there's still time up to 2 days where you might have time to sort of recoup, catch up on sleep, do those things that we all have to do, like laundry and grocery shopping and all those types of things, and maybe take a break so you can recharge and reinvest yourself when you're back on duty the next time. It's also a part of the shift. When you have rounded your case over to the next doctor and you've finished your paperwork and sort of wrap things up for the day and you leave, we're rarely going to call you after you leave. We want you to have that time off and away so you can sleep and recharge and be ready for the next day. So we're not going to be calling you back in if something wasn't quite right with your patient. We'll just, there's another set of doctors who are on duty that day. We're just going to deal with it at the time. Again, those receiving shifts are generally 4 days a week. We do still ask that even if you're off duty for the rounds day, so generally that's Wednesday for those 2 hours, that you do come in and participate. Sometimes we'll hold them virtually because of COVID and everything. Other times we will have you come into the building and participate in those rounds. Some of them are very hands-on and we need you there to do that. There is a little bit of on-call. It generally is not very much. We sort of have it scheduled out so it's maybe 3 days a month, which isn't a ton. Might be a little bit more some months, might be a little bit less other months. Right now we don't actually call you in very often. I would say the average is probably in the range of maybe 2 to 4 times per year where you might get called in. We do give you a little bit of stipend or bonus for that call in. And that that will certainly show up on your paycheck, and we might call you in for a variety of things. It might be to see cases on the floor, it might be to help us get through a bunch of procedures, it might be to help monitor a critically ill patient that we just need extra hands to sort of get through. So there's a variety of reasons, and that's usually at the discretion of the attending clinician. Like I said, we don't really call you in that much, but we do sometimes need that additional support there. A couple of additives to that for the residents, for sure. In addition to those grand rounds, there are resident board review rounds, and that is generally an additional 2 hours. We currently have it right now on Wednesdays between 2 and 4 p.m. That's a requirement of the residency program. It is additional learning time that interns are welcome to come in, or maybe you're someone who is pursuing some of those additional options. If you're moving from internship to residency, if you want to get a leg up, you're welcome to participate in those rounds as well. It's additional time that you're there sort of doing some additional learning, and it's additional time that is a requirement for the residents to participate in. Generally, we're going over physiology, pharmacology, pathophysiology, that sort of thing, reviewing a lot of the standard, like how the heart and lungs work, and then what happens when they go wrong, and then what to do about it. So we're diving into a lot more detail during resident board review, but that is available there as well. I'm going to take a pause right here while I kind of catch my thoughts a little bit, and hopefully can maybe answer some more questions for you. So a few more things I wanted to cover. So just finishing up with the schedule. Of course, we do have a rotating internship program. The schedule is a little bit different for the rotating interns, very similar when you're on ECC, but of course you're going to be going through other services as well. For now, we have the rotating intern schedule set up as half ECC and half of the other specialty services, with a core 8 weeks of medicine and 8 weeks of surgery, and then 8 weeks of elective, which you can spend with any other service. And we do have a little bit of flexibility there. I think the important thing is, again, to emphasize how much support you have on the ECC service. It's not slave labor like you're going to hear about at a lot of other practices. We are here to help you and support you through that. And we really have found that, and this is some of the feedback that we've gotten as well, is that most of your experience and knowledge and ability to sort of deal with multiple different things or challenging cases really comes from the time spent on the ECC service. The ECC internship has been around much longer. In fact, for the residency and the ECC program, we're actually getting into our 30th year. The rotating internship program is newer to us. It's been around for 4 or 5 years. But we think we have a good program there as well, to get some people a little bit more experience with some of those other areas. The other rotations, so medicine, surgery, cardio, what have you, are probably a little bit more akin to the clinical year you might have. Most of the time you're spending time sort of following the specialist, scrumming into surgeries and that sort of thing, as much as you can, trying to learn from them. We do get questions about surgery quite a bit, and whether you have that sort of experience, regardless of the program that you're in. Along with other procedures such as ultrasound, centesis, and wound care, you're going to get a ton of that type of experience. Surgery is probably a little bit different. For the rotating interns, when you're on surgery, most of the time the surgery is going to be done by the surgeons. They may have you help out with certain parts of it, but most of it is done by the surgeons. When you're on the ECC service, I try and get someone scrubbed into surgery as much as possible. Now, it's going to vary depending on what's going on the floor. Of course, you have to take care of those cases. We have had some interns that wanted some additional surgical experience, and so they got called in for those emergency surgeries. I try and have everyone scrubbed into surgery as much as possible, and we do try and do some surgery, quite a bit of it, on the emergency and critical care service. But when we're talking about those major abdominal or maybe thoracic procedures, well, you're going to have a lot of exposure to wounds. You'll certainly be scrubbed in on a few of those procedures. Are you going to be doing them by yourself? Probably not. There are exceptions to that rule. Certainly you can participate in some of it as well. I try and have, like I said, I try and have someone scrubbed in as much as possible. Last thing I wanted to mention, before sort of rounding things out here, is some of the other unique things that Lakeshore does. We actually have a very involved and active inclusion and diversity program at Lakeshore. We have a committee that is sort of headed by one of our operations managers and a bunch of other employees who want to be involved with that, the Inclusion and Diversity Committee at Lakeshore. And they've actually been probably our most active committee, particularly in the last year. The goal is to make sure that that Lakeshore is being as inclusive and diverse and open to other opinions or viewpoints, looking at race and religion and all sorts of those things, to make sure that we are being as inclusive and diverse as we can. And the ownership team has actually taken quite a stance on that, and we have posters that are along the lines of end racial injustice at all of our clinics. We do also have on our name badges, I don't have mine with me, but on our name badges we have our preferred pronouns that are listed for every individual person as well. That's your selection. So it's something that I think has been emphasized and certainly well received to try and make Lakeshore a safe and comfortable environment for everyone that's involved. We also do, of course, have a human resources team as well, and they're there to provide some additional support for you. If needed, there is some additional resources there, like an employee assistance program and that sort of thing. So I hope that kind of summarizes a bunch of the things that Lakeshore has to offer. It's an exciting company to be part of, and I think we have a lot to offer our internship and residency team. We actually have kept a lot of our interns and residents over the years on staff for a period of time. We do get a lot of questions about what do people move on to do, and it's really varied. A lot of it really is up to the individual and their career goals. We've had a lot of interns move on to specialty residencies in ECC. Some we've kept on staff, some have moved on to other locations and maybe matched elsewhere. We've had some of our interns move on to residencies in other programs like internal medicine and anesthesia, that sort of thing. A lot of them move on to GP, that sort of thing. We can talk some more details about pass rates and that sort of thing for the residents if you want to pursue those options. And hopefully you'll have some questions for us on interview day. We're going to have some questions for you, of course. Hopefully this will answer some of your questions and we can spend that time kind of getting to know you a little bit more. So we look forward to meeting with you, whether virtually or in person. We're going to have an interview with all of our candidates and hope that you will consider Lakeshore as part of your future career path. Take care. Thanks.